Hi, this is Sherry with Fitworks Perfect Posture Natural Pain Solutions, and I have Gary with me today, and he is the pioneer of Fitworks Perfect Posture Natural Pain Solutions specific method that's used. Now, a lot of people claim to help with posture problems, but we have seen over 18 years and over 5,000 clients that Gary's method actually works. So I would like to ask him a few questions because I'm sure that there's a lot of people out there who see our information, our videos on the Facebook page and on our YouTube page, and they're wondering more about exactly what is Fitworks Perfect Posture Natural Pain Solutions. So let's hear it from Gary. So Gary, how long has Fitworks been in business?
We've been in business about 18 years. And we started in the year 2000.
Okay, and how did you pioneer this method?
Well, that's a good question. I had gone to the myotherapy college and graduated, and then I had gone to Reebok University and graduated in 4 topics on anatomy. And then I started putting this information together and literally inventing this whole concept and idea of building and stretching specific muscle groups to line up all the joints in your body. And it's so simple. You've got 256 joints in your body, 209 bones, 640 muscles, and you just got to build and stretch specific muscle groups, and you can line up every joint in your body perfect over time. So it's very simple.
So what is the Fitworks quote that sums it all up, Gary?
I'm glad you asked that, Sherry. By building and stretching specific muscle groups, the joints line up gradually for perfect posture, a balanced body over time, all done naturally.
That's right, and you can't put it much more plainer than that, really. So how many people's posture have you corrected, Gary?
We've corrected some over 5,000 people over the last 18 years. It's a lot of people.
Well, out of all those people, have you worked on any health professionals, any registered nurses or physicians or chiropractors or physical therapists or anything like that?
Yes, these guys came to me and they heard about Fitworks Perfect Posture, and we've worked on 14 medical doctors. We've worked on 4 chiropractors, 57 nurses, and 15 to 20 physical therapists. All these people were really impressed with what we were doing at Fitworks. And they said, this ought to be part of the medical industry. And I said, the problem is I'm not a doctor. But it really could be incorporated, because some of these doctors says, man, Gary, everybody should go to you, and if you can't fix it, then they should come see the doctor.
So you're actually looking for the origination of the problem. It could be muscular instead of structural. Is that what you're doing?
Yep, I think most of the time, 95% of the time, I think it's a musculoskeletal imbalance problem.
So basically what we're saying is you need the medical industry, that's for sure. But before you go in and have shots and medications and possibly surgery or adjustments, maybe you should make sure it's not a muscle problem. Rule that out before you tackle anything deeper, because wouldn't you say 9 times out of 10 it's a muscle imbalance that's causing the problems in the first place?
Yep, and if you start building the right muscle and lining things up, all of a sudden the pain's gone.
Okay, let me ask you this question. What's the difference between what you're doing and just going to the gym and working with a personal trainer?
Well, what we're doing is we're designing a program specific to your muscle imbalances. So we're going to do an evaluation, and we're going to understand exactly what joints are all out of alignment.
So when I go to the gym and work out with a personal trainer, aren't they going to take into consideration my joints?
No, they're not even thinking about your joints. They're in there working you out. Their whole goal is to build the muscle as fast as they can and to help you lose weight. But they're not doing anything about posture. They're not going to take you out of pain. So personal training is completely different than what we're doing.
So you're suggesting that if somebody's having an issue, going to a gym and working with a personal trainer may not be what they need to do to correct the issue. They could actually do harm.
Yep. If there's a joint out of place and they load your spine or load any joint in your body, it could create a worse problem. So running off and doing that is not the answer. If you're in pain and you have pain and discomfort, you really should contact us. You can get a hold of us at 407-408-7588, or you can go to fitworksperfectposture.com. And right there on our website, you can basically do an evaluation. But if you're right here close with us, come in and make an appointment. We'd love to do an evaluation, complimentary on the house, and show you what's going on. But if you're at distance, go to the website, do the evaluation. There's 3 easy steps, and then purchase the programs that you need to correct your posture. And then those programs, you can download them and then go right to work at correcting your posture. We've made it very clear and very simple. You'd believe how easy these exercises are.
Well, if you're working on us personally, if people are going in and we're working personally with them, people across the world, across the country, across the states, they can go into your website and download the programs.
Yep.
They can do their own posture evaluation.
Yep.
They don't need to have you.
Nope, they can do it all themselves.
And the people that there's people that have done this by themselves.
Thousands of people.
And have they been successful?
They've all been successful. Everybody has changed their posture, gotten out of pain, and here's the question, it's not if they're going to correct their posture and come out of pain, it's when. So some people it moves a little quicker, some people a little slower. I mean, understand we're dealing with different ages. We've worked on people from 11 to 97 years old. Male, female, you've got different strengths, different characters. All these things have a play in how fast you can correct it. But everybody has corrected these issues. It's just some take a little longer.
Have you ever run into somebody who was in extreme pain and you were not able to help them?
Yes, in our evaluation, if you're in real difficult pain, we want to refer you really out to a doctor. But we want a clearance, and then we want to start building and stretching those muscles to line up the joint.
So basically, you're telling me that you don't need to physically see a patient or a client to do the evaluation or to fix the posture issues?
No, you don't. If you come into our office, it's going to happen a lot faster because we're so good at this. But these things are so simple on the website. When you download these programs, it's very clear exactly what you have to do to correct your posture. So you just take one at a time, or just buy all the programs you need and correct your posture. And time frame, it takes maybe about 6 to 12 weeks. If somebody's working out twice a week for an hour and they're stretching to make their posture perfect. Maybe now and then you'll get somebody that takes 24 sessions. Maybe it's going to take you 24 weeks, once a week or twice a week. But your posture's going to be perfect for sure in that time frame.
So what about somebody who's had a hunchback and a forward head for 50 or 60 years of their life? Are they going to get their back straightened out in just 24 sessions of workout?
Again, it varies with the age, but generally you'll see a man will move his thoracic spine in 3 inches in 12 hours. 24, he could move it in 4 to 5, maybe 6 inches, and it's completely done. But that's moving pretty quick. A woman, half that time. So it'll take her maybe 2 inches and 12, another 2 inches and another 12.
Now let me ask you this question. Having been a mother and being a woman, I have to say there are lots and lots of ladies out there who have had children and given birth, and we are in pain during pregnancy, we are in pain after pregnancy, and decades later we're still having hip and back pain. Is that a posture issue?
That's an imbalance, or the joints are not lined up, yes, and so that's a posture issue, and things are not stable. So when a woman delivers a child, the sacrum moves back posteriorly, and because there's a hormone released to cause the ligaments and the muscle, everything to relax. The SI joint, the sacroiliac joint, separates, the pubic symphysis separates, all for head and shoulders to go through the birth canal. So now they're walking around after delivery and they've always got a hip problem. So they stop, they're not as active as they used. They stop running, they stop playing sports, they stop doing a lot of things. Their back hurts, they're low, their hips hurt, and now they've made some choices where they start getting a little heavier, and it's because their activities changed. Nobody's fixing this. And we at Fitworks have actually found a way to build those specific muscle groups to pull and line up the SI joint, pull the sacrum in, and stabilize that hip and put it right back together again before you delivered that child. Yeah. And now all the pain and discomfort that these people are having today, you could correct it and fix it. And you could buy the information. You can see right there in the downloads of the programs. You could buy the one about curvature in the SI joint. And you could correct all this yourself right at home. So it doesn't take very much to do. It's just knowing what to do.
So it's a muscle imbalance created from pregnancy, is what you're saying.
Yep.
And there is relief for this problem.
Yep.
Okay, great to know.
We probably worked on, I would say about 85% of the women have this issue. And everybody we worked on, we completely stabilized their hips, lined everything all up. They're pain-free. They went back running, ice skating, snow skiing, all kinds of things that they hadn't done in 20 years.
Wow. So when people do correct these issues and they get out of pain, how long does this effect last?
Well, once you've built everything, because we're building muscle,
Mm-hmm.
it's going to stay that way. So you're not going to lose it. That's the thing that's beautiful about this. We're fixing it. We're not just putting a joint in and hope it stays in. We're building the muscle, lining up the joint, and stabilize it and putting muscle around it so it doesn't go back out again. So we're solving the problem for good.
Okay, what if I'm a dancer and my dance that I do continues to create imbalances?
Okay, if you're dancing, what we need to do is design a program specific to your sport. So let's say you're always doing one movement the same over and over, repetition. What we could do is after we line you all up and make your posture perfect, you could keep doing evaluation over the years and watch this and say, I can see this imbalance starting to happen, and you can start correcting it before it becomes a problem. Really, it's sports where people move a certain way in a repetitive fashion that causes these imbalances. So as an athlete, if you're aware of it, you can always keep at it and keep it there.
Okay, so if I'm an athlete of some sort or a performer and I know that my sport or my whatever it is I'm doing is creating imbalances, and I understand that the opposing muscle is continually getting weakened, all I have to do is know which muscles and then work out those muscles.
That's right.
Okay, so people, if you're a gymnast, if you're a cheerleader, if you're in any kind of sports or performing arts and you have issues, this could be something that you could look into to help you with your specific problems so that you'll be able to perform to your best. Now, I know Gary has worked on lots and lots of athletes and performers, and I think one of the big ones was gymnasts and dancers because they needed to do the splits or to get their ankle up toward their ear or whatever, and they couldn't do it, and you were able to help them do this.
Yeah, but some of these girls felt like their instructor or in the program they're in says, you really are never going to get this. You've been stretching and stretching, and you just can't perform like the rest of these girls, and so they really get out of the program. Totally not necessary. They keep thinking stretching's the answer. What the problem is, the reason why they don't have the full range of motion in their legs and hip is because their pelvic girdle's tilted forward. They have an anterior pelvic tilt. And so I don't care how much stretching they do, they're never going to lift that leg up to their ear or the side of their head and stand because the pelvic girdle's tilted forward. So the femur head hits the ilium. So all I got to do is tilt that pelvic girdle by building the right muscle, stretching the right muscle. As soon as that's in the right place, they can go into a split that fast.
Wow.
They can bring their leg right up the side of their head. And they're stunned. They can't believe how fast we we change that.
So also, I wanted to ask, things like knocked knees or bowed legs, is that a muscle imbalance or is that a structural problem?
That's a major muscle imbalance. A lot of people with knocked knees, these are the people that end up getting their knees replaced down the road when they hit about 65 years old. Totally not necessary. All you got to do is build and stretch the right muscle, and you can put those knees right in perfect position. The knee tracks like a door hinge, so we need to make sure that's in the right position so that cartilage and the meniscus is wearing even in that joint. That joint should last 100 years. So these people, all these knee replacements, all could have been, they all could have fixed those and totally prevented that surgery.
Wow. Now, what about plantar fasciitis? Because I know that's a real big problem for everybody as they get older. Your feet start to flatten. What can you do?
You can build the arch. You can stabilize the ankle. You can line up the feet absolutely perfect and solve the whole problem. You don't need the surgery for that either.
So you're saying that the arch is a muscle that you can develop and strengthen.
Yeah, and the reason why they're feeling pain is the distance between their feet and the heel get further apart, and there's a stretching going on a lot of the ligaments and tendons. And then if their ankle falls in, they call that pronation, all of a sudden they'll feel like there's pressure on the heel, so it feels like they're standing on a nail. All you got to do is build the muscles in the ankle, line up the foot, stabilize that ankle, and the problem's fixed, and it's done.
Wow, so basically you're just all muscle, really. There is not, if you're not looking at anything but muscle. You know where the joints need to be, and you know where the natural range of motion needs to be.
Right.
And you're saying that if they're not performing correctly, if the joints aren't where they're supposed to be, and there's nerve restriction or blood restriction, and there's lack of motion, it's because the muscle somewhere there's an imbalance.
It's distorting the skeletal frame. People with forward heads, hunchback, rolled shoulders, curvature of the spine, anterior, posterior pelvic tilts, knock knee, bowed legs, feet that go externally rotate, feet that internally rotate. All these kind of imbalances could all be corrected in just a very short period of time.
So there are some structural problems out there, but most of them are more than likely muscle imbalances.
Yep.
And we want to rule that out before we start looking into a structural problem.
Right.
Because it's kind of like you want to find the origin of your problem and not just be given some kind of a mask to cover it up or a Band-Aid to put over it. You want to find out what the origin is and fix it, if at all possible. So if somebody's having sciatic nerve pain or something, you want to rule out a muscle imbalance before you start looking for bone spurs or herniations or arthritis, because those are all structural problems and diseases. Mm-hmm. And some of those could be because the bones were too close together, so they started
So when you started lining it up, all of a sudden the bulge moved away from the nerve, and then the problem was solved. Mm-hmm. So it's the muscle that moves the skeletal frame around. When you're walking, running, doing any kind of activity, the bones are the structure. It's like the 2x4s to the house. The muscle is moving the skeletal frame around. So if you want to change the position of the joints, change the muscle. A lot of people have said this is an alternative to chiropractic work. A lot of people were amazed that in a short period of time we solved their problem, corrected it, and they're back. Last thing you want to do is surgery. The last thing you want to do is pollute your body with shots and taking drugs to mask pain, because it's not necessary. You can come out of pain pretty darn fast. Sometimes I've had some people who got out of pain in the first session just as soon as we started doing the exercise. So, my goodness, and then they never felt it ever again.
But then you have some people,
everybody
responds differently, but the key here is if they respond to the exercise at the time it's happening and they feel a temporary relief, then that's telling you more times than not that it is a muscle imbalance. If they're not getting any relief at all, even if temporary, momentarily getting relief, then it's probably something deeper.
Yep. Okay. Exactly. I'll tell you, 5,000 people, we've proved a lot of things about health, and correcting their posture was the key. Posture's kind of a catch-all phrase to building and stretching specific muscle groups to line up all the joints. And so really perfect posture is going to free the nerves, free the blood vessels, organs are going to start working better. And we've heard story after story, and we hear it all day long. Oh my goodness, this pain's gone away. All of a sudden now my digestive system's working better. All of a sudden my headaches and pains went away.
My bladder's working.
And we hear this all day
Heard that
long,
one.
and it's all we're doing is building and stretching muscle and lining up joints. So, you could go, there's a lot of different choices in health. But knowing what I know and knowing what I've seen in 18 years of doing this, the first thing I do is I'd come see Fitworks Perfect Posture for an evaluation. And let's see how we can build and stretch muscle, line things up, and solve this naturally. And then, if there's a problem, now start entertaining the medication. Start entertaining going to a chiropractor or surgery. But what if we could fix it in a very short period of time? It's not only less expensive, it's fast, and we fixed it for life.
Okay. So how long would it take to correct a person's posture?
On
Basically.
on average, it takes about 6 to 12 weeks. They'd spent 2 hours a week exercising and stretching. That's about 85% of the time. There's those cases it takes a little bit longer. Maybe it took you, let's say 24 weeks. Oh my goodness. That's a lot of working out. That's happened maybe 2 or 3 times in 18 years. And if I explained to you what was going on with these people, you wouldn't believe that we even started working with them. But it just took a lot longer because the imbalances were so out of alignment. I'm talking about people with a wind in their spine, a huge S-curve, people who couldn't walk, people who couldn't stand. We've corrected that in 24 weeks for sure.
So what's the youngest age of a person who would benefit from what we do here at Fitworks Perfect Posture?
I like working on people 11 to 97. You start getting people younger. What I want to do is bring the parents in, do the posture evaluation, teach the parents how to work with that child, because they'll connect with that parent, and let's make it exercise a game and fun. And so now they can correct their posture all the way down to 5 years old.
So say you have a child who has poor posture and they are having issues. Is that going to inhibit their growth and their development?
It could. It could inhibit a lot of things. You really think about it. The body affects the mind, and the mind affects the body. So you want this child to be successful in life. They need to have a good self-image. Their posture needs to be great. They need to be able to function normally. They need to feel good so they can do the things they need to. Mm-hmm. When I see somebody in school, and I remember seeing this as a kid growing up with these imbalances and these issues, kids made fun of them. And
that's true.
We correct these things and help this kid become more active and perform in their sport.
More self-confident.
Their confidence is going to go way up. Their grades are going to go way up. It affects everything. So,
well, do you have an example of a child that you've been able to help that it was a posture issue and medically they didn't know what was wrong?
Yes, I do. In fact, many of them. You want me to share one?
Share one that you know you
so
can share.
I know somebody who, very, very young, who lost the feeling. They never had the feeling in their leg from the knee down on their right leg. And so there was no feeling in their toes. Their feet didn't work and contract, or their toes. And they spent somewhere around $17,000 doing tests with doctors.
Over how long? What time was that?
I don't know, about a year or so. Yeah, I think it was. And so a doctor actually referred them to us. I did a posture evaluation, and I says, I can see what the problem is as far as the posture. And the parent says, do you think you could help her foot and her leg get feeling back and grow again? I says, I have no idea. But
grow again? What was wrong with the growth?
Their foot wasn't growing, so it was quite a bit smaller. So at the end of the day, I says, I can correct her posture. I can stabilize her SI joint. I can straighten her spine. I can line up her head. I can take her knock knees out. I can line up her feet. I can help her be more flexible. And in just doing that, it increased the blood flow and freed the nerves, and her foot started growing. In 6 weeks, her foot had grown 1/4 of an inch and 1/8 of an inch in diameter around her ankle, which is very, very fast. So posture, does it affect?
Did she get her feeling back?
All the feeling came back in her feet, yep, and all the use of her foot, totally normal. And it's still growing right now. So we're talking about an 11-year-old girl that magnificent results in a very short period of time. So we're still working with her, but there's no reason why her feet won't be exactly the same.
So basically, poor posture is a symptom of a dis-ease in the body.
Yep. You're in a state of dis-ease. It's like all 4 tires in your car out of balance, and the front end and the back end of your car are out of alignment. That car is going to have a hard time going down that road very smoothly. You line up all those tires and balance them and line up the front end and the back end, it rides smooth. It's the same thing with your body.
So it's a biomechanical engine
Yep.
that we are in a
Yep.
machine.
Yep. And all we got to do, the secret is just build and stretch the right muscle. You can line up every joint. If I could list off all the surgeries that are going on that you don't need today, you can do it naturally. I can list all the adjustments that you've heard or experienced, and it's totally not necessary. All the drugs, all the shots that people are taking to mask pain is totally unnecessary. You can do this naturally.
So like 95% of those things going on out there could probably be helped by an origin of just muscle imbalance, and that's the problem.
Here, let me tell you another story. I had a guy named, well, I won't tell you his name, but he was a golfer, and he had to stop playing golf. He had so much pain, the doctor says, we're going to put titanium pins in L1 through 5. You've got 5 herniated discs. Stop playing golf, schedule you for surgery. And all of his golfing buddies says, go in and see Fitworks Perfect Posture. He came in for an evaluation. He had sciatic nerve pain down the right leg. And he says, Gary, I have been on every drug that they come up with for pain, and none of it's cutting it, and it's affecting my whole life. I'm a mess. He's about 45 years old. So we immediately, because he was in such pain, I started doing some exercises right there. His sciatic nerve went away, and I did 10 reps to a certain muscle to move his spine.
The sciatic nerve pain went away
and
right there?
His sciatic nerve pain went away that fast. And he goes, what are you doing to me? I says, I am building muscle to line up the joints in your body. And all the bulge of some of those discs and those herniated discs are backing off from the nerve.
But it didn't last very long.
No, that's been 5-6 years ago. We did
But I'm
12.
saying those 10 reps, that didn't last long for him. He needed to do the actual sessions with you or fix it.
Yeah, we needed to. He
permanently.
bought a package. We did 12 sessions, and we got it all his spine perfectly lined up.
So,
I think the key thing to understand here is this is really simple, and everybody's missing it in the medical industry. They're not even thinking about the muscle.
they're thinking too deep.
They're just looking at the joint and they go, well, that joint's touching, that vertebrae's touching that vertebrae, and calcium is forming, or arthritis, and so,
Or spurs.
we need to just give you a shot so you can't feel it anymore. And then if that doesn't work, then we're going to go in and do surgery. And then after they do surgery, 2 years later, they got scar tissue to deal with. And the message I have to people is, golly, I could have built the erector spinae on the opposing side and made the spine absolutely perfect in maybe 2 or 3 hours of exercise. Now you think about that.
So
If that's true, you need to come in here to Fitworks Perfect Posture and let me take you out of pain. That pain you're having right now, that thing you're feeling in your body, I don't care where it's at. Your neck, your hip, your back, your feet, your knees. Come in for a posture evaluation and let us teach you how you can build and stretch the right muscle, line the joint up, and watch the pain and discomfort go away.
Yeah, look for the muscle imbalances before you go deeper than that. If it's not a muscle imbalance, we'll tell you, and then you can go on from there. But what have you got to lose?
And if you're from out of state, go to the website at fitworksperfectposture.com and purchase do the evaluation, and then purchase the program, and do the exercises and see for yourself. I mean, they're so inexpensive, I can't believe it. I mean, why not invest a few dollars?
Specifically for your imbalances, so you'll know every single exercise to do. It will be specifically for you after you've taken your posture evaluation.
And then we want to hear about your story. Write us a review on Google, or
we love to hear about
send us your review. Call us on the phone.
Do a video. Send it to us.
We love hearing that stuff, and we hear about them all the time. And
sure do.
we got a huge family of real healthy people because of it. Okay, so we'll see you out there. Give us a call.
Well, thanks, Gary. Appreciate it.
Thank you, Sherry.